Welcome to the fourth video in Take 5 to Fight COVID, an educational series presented by the New York State Association of Healthcare Providers, HCP. My name is Carol Dio, and I'm with HCP's public policy team. And yes, I received my COVID-19 vaccine. As a pharmacist and a certified immunizer, I'm thrilled that you took the step towards protecting yourself from COVID-19 disease by getting your vaccination. Studies show that being immunized is very likely to prevent you from becoming seriously ill from COVID-19 infection. The vaccine causes your body to recognize and stomp out the virus before it makes you sick. Our work with other vaccines tells us that by reducing the active virus in your body, you're probably less likely to spread it to others. Thank you for being immunized. Because we need some time to study the vaccine's effect on COVID-19 spread in our communities, and because not everyone can get vaccinated yet, you still need to wash your hands, wear your mask, and watch your distance. Eventually, when enough people are vaccinated, we hope to go back to our normal, busy social lives. Washing our hands is a habit we'll keep to stay healthy. So you got your shot. What now? In video 3, we talked about some mild side effects you might have because your immune system is hard at work. Since scientists want to know how each person feels after this vaccination, we have a system called vSafe to monitor everyone who is immunized against COVID-19. Using a simple app on your phone, you can report how you feel each day. It's fast, it's easy, and it allows you to participate in the important work of fighting COVID-19. When you're at your vaccination appointment, you may be given 1 or 2 pages to read about vSafe. They will look just like this, but they might be black and white. You can sign up for vSafe by scanning the QR code with your phone or by going to the registration site, vsafe.cdc.gov. We'll keep that web address on the last slide for a minute if you need to jot it down. Once you get started, you'll need to just enter some basic information about yourself, like your date of birth and zip code. This information helps us see if certain groups of people are having the same experiences with the vaccine. For example, if only young people get a headache, or if older people never get a headache, that's good for all of us to know. Enter your personal cell phone number. That will be your connection to vSafe. Your phone number will not be shared. Then you'll need to enter your own vaccine information into vSafe. The brand of vaccine you received, Pfizer or Moderna for now, and the lot number are on the card given to you when you were vaccinated. It looks like this. If you don't have your card, contact the vaccine site to get it. It's important to have this information in your health record, and it's needed for monitoring so we know if folks feel different between brands or lot numbers. You can be sure your information is kept private and is only used for vaccine safety. The vSafe app will never ask for your Social Security number, financial information, or citizenship. It's that easy. You will now receive a vSafe text each day reminding you to check in for 7 days and once a week after that. It's just one click from the text directly to the app. You'll be greeted and asked how you're feeling overall. You don't have to do it right away, just try not to forget. A few short questions will come up next. First, you'll be asked about the arm where you got the shot. It's important to know if a lot of people have a sore arm. Next will be a series of specific complaints such as headache and fever. Click the ones you feel, then the next screens will ask you if those feelings are mild or if they're interfering with your daily life. All of these answers are important to collect information about the vaccines as more and more people get them. This whole check-in only takes a couple of minutes. When you're finished, if there are any problems you have that seem unusual or severe, you will be contacted on your cell phone for more information. By using vSafe, you can help us all have factual, up-to-date reports about how the immunizations might make people feel. It's important research, and you're helping. vSafe will even remind you when it's time to get your second shot. Remember, If you are ever asked for your Social Security number or for financial or citizenship information, back out immediately. This would not be the official vSafe app or website. Besides vSafe, there are other monitoring systems being used for COVID-19 vaccinations. There's a system to track side effects in nursing homes and another one to collect information from folks in the military. The more data we can collect, the more we can show everyone how safe the vaccines are. In the United States, we also have a monitoring system for all vaccines that's been around a long time. The Vaccine Adverse Event Reporting System, or VAERS for short, is used by healthcare providers to report any problem that might be due to an immunization. Like vSafe, any unusual or serious problems are flagged for complete follow-up with the provider and sometimes the patient. Providers are encouraged to use the VAERS system for all vaccines. And with COVID-19 vaccines, they are required to report any serious events such as hospitalizations or even COVID-19 infections. That's why it's important for you to tell your healthcare provider if you have any physical effects after the vaccine that bother you. Also, be sure to let your provider know if you feel you might be sick with a COVID-19 infection. There's only a very small chance of infection after immunization, and it's important to know if it happens. And it's important to know that you cannot get infected from getting the vaccine. So you see, besides all the information collected from the tens of thousands of people who were in the vaccine trials, scientists will continue to collect details from the millions of people who are getting vaccinated now and far into the future. In this way, we can all know that COVID-19 vaccines, and other vaccines too, are very safe. More people getting vaccinated means fewer people getting sick, and that means fewer people will die from COVID-19. Don't forget to watch video 3 about what to expect if you're wondering about side effects. And tune into our future videos, which will explain more about COVID-19 vaccines, like how they work to protect us and our communities from serious COVID-19 illness, how they were developed quickly and safely, and much more. Thanks for joining us. All this knowledge gives all of us, the power to fight the pandemic and get back to normal. HCP is grateful to our associate member, Nevan, for donating Spanish translation services for this educational series.